In this room are member representatives, soon to be members, friends of the Coalition, supporters and collaborators. The EPLC is a representative peak body. We aim to elevate the voices of our members and support their work across the sector while advocating for the sector as a whole and for the people who experience loss and those around them. Our work is and will always be underpinned by science, data and lived experience. Everyone involved with the EPLC, including myself, is a volunteer. We have worked incredibly hard and are proud to share this vision for the next stage of our journey as we work together to improve care for people who experience miscarriage. Thank you so much to EPLC Chair Liz Chatham and the board for their support, dedication and commitment. Thank you to my fellow EPLC co-founders Melanie Keep and Jade Bellardi, who also serves as Deputy Chair on the EPLC board. Thank you to PwC and its Miscarriage and Fertility Support Network, represented here today by Amy and Shahed, who committed pro bono hours to the EPLC to help us develop this strategic roadmap and articulate it in the best way possible. Thank you also to EPLC volunteers Rachel Allen-Bacchus and Yoko Baxter for bringing the final document together so beautifully. Our thanks to our advocacy advisors Tank, represented today by Neil Farrow, as well as Brazier Trail and Arnold Block-Liebler. Huge thanks to the Victorian Women's Trust, represented here today by board member Dee Chimpungu and the Deborah Ganderton and John Henry Subfund for awarding us with a grant to be able to host this event today. After some words from the Minister, we will eat delicious Syrian food, meet, chat, network and put faces to names. We will hear about each other's work and forge relationships so we can move together into a better future. When my daughter was born, she had I'm going to try not to cry. Sometimes I get a little broken when I read this, but I'll power through. She had one older living brother and 7 angel siblings. I swore that I would change the world so that she and her brother would never have to navigate the pain, silence and stigma that I had to navigate to find her and her brother. This document marks an important step in that journey, but it's not a step I'm taking alone. No, I am in very, very good company. I'm now going to invite the Minister to say a few words to launch our strategy.
Thank you, Izzy. I really appreciate the opportunity to be with you all here today and to congratulate you on putting together such a fantastic document. I think we need to do a quick shout out to the birthday boy. You missed that. Oh, sorry, I'll leave that to the end. It's just a teaser. But first, can I please acknowledge the traditional custodians on whose land we are meeting today and pay my respects to elders past and present, and welcome any Torres Strait Islander or Aboriginal people who are joining with us in the room this morning. I'm from Tasmania, where we acknowledge the Palawa people of the Trawita, and one of my great joys travelling around the country is learning about the culture of First Nations people everywhere I go. And another hat I wear is Indigenous health, so I've been really privileged to be able to have lots of conversations with people around our nation and feel so deeply humbled by their generosity in sharing with us all that they know and their culture with us. Izzy, you could have said so much more, and I would like to pay tribute to you for your leadership and thank you very much for your engagement with me since I've stepped into this role in my office and your broader volunteer team and the board. I know that it takes a lot of effort and energy, particularly in a volunteer capacity, to do the work that you do, so I just wanted to recognise that. The work that has been done to bring together a coalition is incredibly powerful, and Liz and I were sharing earlier our reflections that in government you're often meeting with lots of different people, singularly advocating for particular areas of their interests, all very worthy and commendable. But the power in what you've done in building a coalition is something that I just want to acknowledge because it's so incredibly commendable. As a government member, you're often hearing from people, and often it can be quite fragmented and disjointed. And competing interests can often mean that it's very difficult to make a decision about the best way to proceed or who is providing the best option. The way that you're working collaboratively across the sector to build a coalition and to develop this strategy is not only exciting for the work that you've put forward, but it actually makes our job so much easier. And it gives us confidence that we can work with you to implement strategies like this one, because we know that it has your full support and it has been widely consulted, and that there is an empowerment, particularly of the women whose voices need to be shared with us when it comes to pregnancy, loss and miscarriage. So I just wanted to say thank you very much for that work, and to recognise from my perspective how valuable that is, and to tell you all to not underestimate the work that you have put into this and how impactful it can be. You each know in this room the significant impact of miscarriage, and you each know also that there are many stories that we don't know about. It is widely underreported, and even the data that we do have shares with us the heartbreaking number across the country, about 1 in 4 pregnancies. It's something that you're doing to raise awareness and support and provide assistance to those families, but also as a government we're really seeking to help provide better communication, better services, and hopefully in some instances I've worked with organisations who are looking to do early identification through the Tim Tams work, which I'll talk a little bit more about in a moment. I'm lucky to be a mum of 2 beautiful kids, 4 and 9, and feel very grateful every day that I'm in a position where I can support them to grow up to be healthy and well and hopefully thrive in our community. But I know that's the story, that's not the case for everybody, and I've got great friends who have stories just like yours, Izzy. The opportunity that we have in this room to build a coalition as you have of network and support is incredibly valuable. And also, one thing that I think you're all aware of is our government's deep support to women's health more broadly, and the way that we're working across government to ensure that women's voices are heard and that they are listened to in a way that is compassionate and it delivers meaningful outcomes and improvements for women's health. There's reforms that are being rolled out as we speak. I recognise that you've been involved in many of those, Sarah, and I won't speak about all the specific budget items, but I will touch on a couple that are specific to dedicated funding for women and families impacted by miscarriage, or to improve miscarriage education awareness and national data collection. There was a commitment of $9.5 million in the most recent budget, 24-25, just doing my financial year calculations. And I'll just run through quickly what they are, which you're probably familiar with, but there's $5.5 million for frontline miscarriage support services. There's $1 million for the AIHW to undertake some miscarriage data study. And there's $1.5 million for the National Audit of Early Pregnancy Assessment Service Clinics, which are outpatient clinics at hospitals and can provide medical care to women in their first trimester if they're experiencing an early pregnancy loss, and $1.5 million to develop miscarriage education and awareness resources. And I think the Early Pregnancy Loss Coalition is one of the 5 organisations closely involved in the market research for that information pack. And then Health Direct Australia is also updating the pregnancy, birth and baby website to provide women, families and health professionals with evidence-based guidelines and resources about miscarriage. So there is work that is happening right now that I know each of you are familiar with, but of course, as always, there's more work to do. And I mentioned earlier the Tim Tams study, and I've met with some of the researchers who are undertaking this work. And for those of you who are unfamiliar, it's a part of a $25 million investment that we're making into research into infertility, pregnancy loss and menopause. But the Tim Tams component is a $2 million study to validate the first placental health test across Australia, which could have an impactful change in supporting health professionals to work out which pregnancies are at risk, and then support those families to hopefully continue a pregnancy through to full term. And we're also doing work with the Australian Living Evidence Collaboration, I should say, in partnership with a range of organisations, which is to ensure that we continue to provide the most up-to-date recommendations about the risks and support for women and families when they need it. There's a lot of work that we're doing more broadly in health. I referenced the women's health package at the outset, and that includes access to cheaper medicines, more bulk-billing GP appointments. I think one of the things I want for every woman, no matter where they are and no matter what stage in life they're facing, is that they can go and see a health professional and not have cost be a barrier to that, and to be able to access advice and healthcare, and then if they need medicines, to be able to get those medicines that are listed on the PBS. I want women to be able to walk in to see a GP and have that health professional treat them with sincerity and take their concerns seriously, and they don't walk out of there feeling dismissed or minimised or like their symptoms have not been appropriately dealt with by that health professional. We're doing a lot of work to provide better education across the primary health network to upskill health professionals, particularly around women's health. And I think that is one of the things I'm most proud of, because no matter where you live, if you need access to somebody who's going to listen and care and support you, I hope that you can find it without having to go to a specialist women's health service. As fabulous as they aren't everywhere. And as someone who grew up in the country and represents a rural electorate, I'm particularly passionate about making sure we have better equity of access to health services. And that includes for people who are living in remote communities like our First Nations communities, multicultural communities, recognising Adele is here as well. But there are other barriers that we have to also break down so that women everywhere from every walk of life can have access to the healthcare that they deserve. And that means also making sure that the work that you're doing as the coalition is considered by government with respect to how we provide these supports and services to women who are dealing with pregnancy loss. So thank you very much for your advocacy, for your passion, for sharing your personal stories with grace, as always, and with generosity, because it is lived experience that I think can be the most powerful motivator for not only people to get engaged with work like this, but for us as decision makers to really make it real in a way that then drives tangible responses and actions. And that can be really hard if you're the person sharing your lived experience. So thank you for offering a way for people to do that in a supported environment. There are fabulous pastries, apparently. But can I just finally finish by saying congratulations. This is a wonderful document, a lot of fabulous work, and I'm really proud to be here to help you launch it today.
Thanks everyone. So there are pastries, and happy birthday to the videographer, who happens to be my husband. He turns 50 today, so I am officially married to an old man, but I'm okay with it. There's pastries, tea, coffee, and this is the fun bit where we all get to meet and chat and collaborate and do all the stuff that makes the magic happen. So please enjoy, and thank you so much again for attending and your very kind and generous words. Congratulations to the coalition, and I have a for you for saying, just a small gift for saying thank you for coming, and thank you to Daryl for reminding me. A small gift. Thanks again.